again, thanks to organizing committee for the very nice organization. I know that everybody are tiring because fourth day today. I have also two presentation before. First presentation, some factors, production factors, effect on bee venom quality, bee venom composition, and second time I presented plants factors, effect on the bee venom composition. Today, different topic, antitumoral effect of Anatolian honeybee. This study is not finished. Also, I will present some part of the study, preliminary study. Everybody knows that bee venom is a chemical defense agent that bees use to protect themselves. Also, their chemical composition very rich: melittin, apamine, adolipine, phospholipase, histamine, dopamine, norepinephrine, and etc. Many rich composition have been in bee venom. Recently, anti-cancer effect of bee venom studied. Also, cancer disease and death rates have increased dramatically. Healthy and economic problems have been occurred. The need to discover alternative medicine and new strategy in the treatment of this disease has been indispensable. Therefore, studies on different possibilities of anti-cancer research and treatment types of cancer have been one of main tasks of modern science. Biological materials such as bee venom contribute to important advantages of medicine. The use of natural products and their active ingredients in the treatment of the disease is basically based on traditional medicine. Melittin is the main active ingredient of the bee venom, which has a strong hemolytic activity. This feature allows it to be easily attached to negatively charged membrane surface and distributes the integrity of the phospholipid layer of the cells. So, researchers in the recent times found that basically melittin can inhibit the growth of the cells as a calmodulin inhibitor in the cell membrane. In addition, melittin is thought to have biological effects due to strong membrane distribution activity. The aim of this project in the study, it was aimed to reveal the cytotoxic effect of the honeybee venom on glioblastoma cell, C6 cancer cells. Our method, firstly, we collected honeybee venom samples. We used electroshock-based harvesting device, and firstly, then glass plates covered with bees. We placed it inside of the hive, the plates. Then we taken from the hive the plates, and the bee venom will be harvested quickly by scraping method. Then we analyze the honeybee venom samples by HPLC UV analyzers. I didn't talk about many things, HPLC UV analyzers. Then we did cell culture analysis by MTT analysis. The cancer cell lines was grown in the appropriate cell culture medium The C6 cell line to be used in the experiment was the cells was incubated in Dulbecus modified Eagles medium, and with the addition of 10% of fetal bovine serum at 37 centigrade degree in 5% carbon dioxide environment. Firstly, I will show, now you are seeing on the computer, bee venom analysis results. We did many analyses and we analyzed a lot of samples, and we selected good composition, having good composition honeybee venom, apamine phospholipase and melittin composition of the sample used for the cell culture. You are seeing on the computer, and also you are seeing the cell culture under the macroscope, cell line and living cell line pictures you are seeing. And our results, you are seeing also on computer, control groups and dose groups. Also, negative control and positive control, you are seeing the on figure. Increasing dose, with the increasing dose, cell line or cell viability decrease. With the increasing dose of the bee venom, cell viability were decreased. You are seeing also doses 0.7, 1.5, 3.0, and 6, and 2 times more doses we use, and cell viability decrease. Honeybee causes more damage to tumor cell membranes due to its greater membrane potential. Melittin content of honeybee venom is a non-selective cytolytic peptide that breaks down all prokaryotic and eukaryotic cell membrane. Its danger also living or healthy cell, It can be danger for healthy cell. One of the problems encountered in current treatments is that the treatment methods can negatively affect the normal healthy cells as well as the cancer cells. Therefore, new approach are needed in cancer treatments. The use of nanoparticles in a biomedical sense is a promising approach in cancer treatment recently. Melittin content of honeybee venom is a potential anti-cancer agent. However, directly application of melittin in vivo and in vitro has had some negative consequences, negative results. To eliminate this, melittin was conjugated to the liposome or embedded in the liposome. When melittin to be used in cancer treatment is applied together with two-dimensional nanoparticles, the therapeutic effectiveness can be increased and even recommended for use as a chemotherapeutic agent. Thanks for your attention.
And
Yes.
Now we will pass to the Dr. Goodwin.
Yes, Professor Arslan. I've already got her presentation.
Okay.
Just Professor Meral to close this, stop the share screen. Thank you very much, Professor. Yes, and I'll do this. Here is the presentation from. Yes. Can you see it?
Yes, we can.
Okay.
I'm Dr. Bridget Goodwin from Australia. I'm here to speak with you today about a case of
Actually, we couldn't see it, I think.
Stefan, we
Okay, you
just
cannot
see
see?
the folder.
Okay, okay. Wait a second. Wait a second. Then I need to activate first the video. I will stop it here a bit. Okay, and then I come back. Now, okay, stop share. And I'll put again. Yes. So this technique is sometimes troubling. Okay, share screen. And I have it. It's going. Can you see now? It should come now. Can you see now?
No.
No.
Wait a second.
Hello everyone, I'm Dr. Bridget Goodwin from Australia.
Still don't see?
No.
Just we heard the sound, but we couldn't see the video.
You hear the sound of
Yes.
Bridget, but not the. Okay, let me because it's very funny. Why is like this? Okay, let's stop share first. Okay, let's be calm. I stop the share
Okay,
first.
I will represent my presentation if you want.
Yes. Give me one more chance. One more
Okay,
chance. And if
okay.
it doesn't work, we.
Okay, we are waiting.
Okay. And then. Okay, one more chance.
Stefan, if
Yeah.
you want, I can
Yes.
help you.
Yes.
You need to firstly open the document before sharing.
Yes.
And then click share screen button and choose the screen that you want to share.
Oh yes. Now I've got
Okay.
it. This one?
Yeah, we can see right now.
Yes, we can see. But we cannot hear. You need to share computer sound.
Okay. Wait a second. Computer sound. Share sound. Yeah.
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 And bee venom.
Now it's okay.
Okay.
Yes, okay, great.
Just a little bit about me. I have a PhD in medical experiments on human skin during wartime. I run Dermal Therapy College. I studied apitherapy last year with Dr. Stefan Stangachu. I run Oz Apitherapy Spa here in Australia, and I'm also a cannabis educator. This paper is about a case using bee products for what was intended to be a conventional skin rejuvenation treatment. This case is unique in that it's a combination of bee propolis, bee venom, and cold plasma using for a treatment on basal cell carcinoma. Basal cell carcinoma is a very extensive type of cancer in Australia because we have such a high incidence of skin cancer and we have very poor abilities to be able to protect ourselves from the sun. In 2020, the research site Statista reported the countries with the highest rates of skin cancer worldwide, and Australia had the highest with roughly 34 cases in every 100,000 of population. Currently, the mainstream allopathic method of treating basal cell carcinoma is through surgery, chemotherapy and radiation. This paper is about exploring apitherapy and cold plasma as an alternative treatment. The subject of this case study is an aesthetician from the Gold Coast in Australia called Diane. She was a horse rider as a young girl. She was also a good attendee of the beach, which is common in Australia, especially on the Gold Coast. And other members of her family had also suffered from skin cancer, with her father dying of melanoma, her mother dying of leukemia, and her 37-year-old daughter has also had several BCCs removed. Now, Diane actually encouraged me to do this treatment. She pushed because she just didn't want to have Mohs surgery, which is the normal facial surgery that people have for basal cell carcinoma. Diane was very concerned about the case of a famous model in Australia called Deborah Hutton, who actually went public about the treatment she'd had to have for basal cell carcinoma. Now, Deborah is a famous model in Australia. She's very well known on our TV screens, but when she had this serious facial surgery, she decided to go public to warn other people about the risks of skin cancer. This is from Deborah Hutton's Instagram page, where she left a message there for everyone to say, please get your skin checked regularly. This has happened to me a few times, and I really urge everybody to try and take skin cancer more seriously. Now, Diane actually encouraged me to work on her with a system I have called Cold Plasma. It's a Korean device called Plaxel Plus. She knew that I was training in this device. She asked me would I work on her, and I agreed to do this, but only after I encouraged her to check with her doctor first. This is just a small video of cold plasma in operation. There have been FDA studies in America on cold plasma and how it actually has been shown to successfully shrink tumors. In my clinic, I train laser skin resurfacing, fibroblast, microchanneling, and a lot of these techniques operate on the principle of what's called the wound cascade. That means the technology stimulates collagen and elastin, and it encourages the skin to regenerate and to rebuild from the fibroblast cells. And this process is called the wound cascade. So really the skin is stimulated into healing itself. Diane kept urging me to work on her because she kept saying she didn't want to be like Deborah Hutton. As I said earlier, I did encourage her to check with her doctor. We got the okay from the doctor, and then we proceeded with the treatment. Even though I have a full laser license from Queensland Radiation Health, I'm very conscious that as an aesthetician, this is a bit like crossing the line, doing something that is going into the realm of dermatology. So that's why I was very conscious that we encouraged Diane to check with her doctor. The doctor gave us the okay and said, if it doesn't work, come back and I'll cut it out. So as you can see, Diane's face was quite marked by the basal cell carcinoma. There were lots of patches of rough skin. So with the treatment, I sort of, after numbing her quite well with our benzocaine, lignocaine, and tetracaine cream, I sprayed the areas that needed to be treated, and then encouraged her with the process that she needed to stay out of the sun and be very careful while the wounds healed. So the way this treatment is done is by hovering just a little tiny bit above the skin and spraying the areas. And what actually happens is after a few days, a crust appears, and underneath that crust, fresh skin is growing. So you have to encourage the patient to not scratch, stay out of the sun, keep it dry, and allow it to heal. So this is allowing the wound cascade to actually do its job. For aftercare, I gave Diane some aloe vera and colloidal silver gel to apply if it was feeling uncomfortable, and just work with the skin as it scabbed up and allowed itself to heal naturally. Diane was very happy that after a few days, the scabs fell off on her bed sheets and her skin started to clear. In less than a week, all the scabs had fallen off. Her skin was starting to look refreshed. Diane was very excited, and she was taking selfies every day and sending them to me. I also encouraged her to start using bee propolis and to take capsules internally. So putting the bee propolis on the areas we'd treated, taking bee propolis capsules, and being very careful to stay out of the sun. I gave her some bee venom, manuka honey, and propolis cream to start putting onto her face as it was healing. So she had the benefit of all of those bee products after the cold plasma treatment. Now, there's been a lot of research on the characteristics of beehive products useful to the structure of and functioning of the skin. And it seems that of the beehive products, all of propolis, honey, and bee venom can be used usefully for the skin, and they all have great benefits, which I go into in detail in my written paper, but I unfortunately don't have time to go into in the oral presentation. Propolis is, as most of you know, a type of resinous waxy substance, and it has many qualities that are really very healing for skin. Honey, as most of you know, is very good at encouraging moisture and also has healing properties as well as anti-cancer properties. Bee venom is not that well known, but is very powerful for shrinking tumours, for encouraging collagen and elastin, and works obviously beautifully with honey and propolis as a beautiful face cream to put on, as well as you know, the possibility of doing all sorts of treatments with infusions. There is a lot of hard science about the anti-cancer properties of beehive products, and I haven't gone into using it in this paper, but I understand royal jelly is also a very powerful beehive product for this type of treatment. Honey has a lot of recorded medicinal benefits going back to prehistory and is quoted in ancient Egyptian texts and in the Bible and the Quran. So we used the honey, cream, propolis, and bee venom to work on the BCCs, or to start looking at ways that not only was the BCC healing, but also starting to encourage prevention. So there's been a lot of research into bee venom directly working on cancer cells. In 2018, there was a study on how it shrinks breast cancer cells, and this research was also done in Australia in 2020 on rats, and it showed that bee venom could actually shrink breast cancer tumours. As I just said previously, we started to look at the notion of prevention in relation to Diane's BCC, given that skin cancer unfortunately has a habit of coming back, and I was really encouraging her to keep using these products to try and prevent a recurrence as much as possible. Propolis has been shown to have quite a good role in tissue regeneration and shrinking of tumours as well. And there's been a lot of research into propolis specifically for these things. As you know, it's antimicrobial, antioxidative, anti-ulcer, and anti-tumour. In Australia, a professor of chemistry did a lot of work on Kangaroo Island propolis in South Australia because of the cancer healing properties of a type of propolis that was being collected by bees from a sedge plant native to that area. In using bee venom, we had to be very careful that Diane wasn't allergic, and this is certainly something to be aware of. Also, generally, if people have high blood pressure or cardiac conditions, it's best to make sure that bee venom is not contraindicated for safety, And certainly there's a lot of discussion about how it's important to do a test patch, make sure the person isn't allergic, and proceed with caution. With basal cell carcinoma, there's been a lot of research about how widespread it is and how common it is in Australia. And our government medical system called Medicare says that there are over, in I think 2017, 2018, there were 950,000.
Dr. Stefan, we couldn't see the video. I think.
Like BCC.
Okay, thank you.
That means 2,500 treatments per day. The classic allopathic treatment of BCC is a surgery called Mohs surgery, which means really going in and cutting it out. Often, obviously, this is quite successful, but sometimes BCC occurs in an area where it's very awkward to cut out a piece of skin. Unfortunately, this person had a BCC on the tip of their nose, and as you can see here, this must have been a very distressing type of surgery, although I understand that plastic surgeons are very, very capable. It doesn't look like the sort of surgery many people would be comfortable having. However, it is the main type of surgery for this type of cancer. There's also a very high incidence of basal cell carcinoma returning. So this is why I was encouraging Diane to please think about prevention when it comes to using the bee products. Look at lifestyle, try to be careful, stay out of the sun, and keep using the propolis, the bee venom, and the manuka honey cream. Of course, this experience led me to studying apitherapy, and I developed a much deeper understanding of what had happened. And I became fascinated enough, of course, to become a beekeeper and to want to know a lot more about apitherapy. Thanks to Dr. Stefan Stankicu, I was able to do a deep dive into the research and find out so much more during COVID when we weren't able to work, as I'm sure most people around the world were not. The study really inspired me to want to know more, and Diane kept wanting to smuggle me back over the border to Queensland to work with her, which is why I couldn't get up there. The Queensland Police turned me around because our state borders closed during COVID. So Diane was sending me selfies of herself every week, and she sent this picture on her 65th birthday. Was in October, and she was very, very happy because her skin was clear, and so many people were telling her that she looked great, and she was very, very happy. And she sent me some lovely messages thanking me for the treatment, which was really very satisfying. Also inspired by this experience and having the time during COVID, I made lots of bee formulations, and you can bee soaps, bee serums, and I've really enjoyed doing this and using them in our treatment and in our training. I sourced some bee venom from Leonidas in Croatia, had some really interesting chats with Leonidas about what they do. They send medical grade bee venom all over the world, which is very, very interesting. This was the bee venom, manuka honey and propolis cream that I made using the Leonidas bee venom, and we're still using that and selling that in our salons, and our clients love it, and the results we have from it are great. It was said in the Apitherapy handbook that bee venom is better than Botox, and obviously it's a lot more bioavailable, safer, kinder to the body than Botox, but it's as many of you know, not that well known, and not that well known as an alternative. So I certainly think a lot more could be done with bee venom in skincare, because it is so very, very effective and just not toxic. these are pictures of Diane's before and afters, and I just wanted to say that I was really kept encouraging her to be careful that the BCC doesn't come back. There's a bit of a tendency for people to think it's gone, I can go back to the beach, but I really urged her to be careful, to look after herself, and really keep an eye on it, and hopefully she can keep it at bay without having to have extensive surgery. Diane sent me her words to pass on to the conference about her experience when I was asked to get her patient's perspective. She says, I was concerned about not receiving surgical treatment of the BCC if I could avoid it. I was willing to try this treatment using cold plasma and B products to shrink the BCC to try to get rid of them. Over the months between August and October 2020, when my skin cleared, I was very happy that the procedure worked. It would seem to be a viable alternative for people to try when they have BCC rather than resorting to surgery in the first instance. Of course, Diane gave full informed consent for this treatment. In fact, she pushed when she wanted the treatment to be done. The fact that she was an esthetician meant that she was very aware of the risks. I encouraged her to talk to her doctor. She talked to her doctor. She had confirmed the diagnosis. She had her doctor's permission to work with me. I wouldn't have done the treatment if she hadn't been so insistent. So she absolutely gave me informed consent, and I think she was brave and she was very trusting, and I think without her attitude, this treatment probably wouldn't have occurred and we wouldn't have this great success story to tell you today. So the conclusion is that severe sun damage and basal cell carcinoma is common in Australia, and there are few treatments offered other than Mohs surgery, whereby the patient is subjected to surgery and possibly scarring as a result. Other milder treatments don't seem to be enough to stop this type of cancer returning. The problem we have in Australia is apitherapy is not well known. We don't have the depth of understanding that many countries like China, Eastern Europe, United States have about apitherapy. So it's difficult to convey to an Australian public that there is an alternative treatment using apitherapy for basal cell carcinoma. It will take education and hopefully medical doctors who are willing to cooperate with apitherapists to attempt this type of procedure. If it wasn't for Diane Stubbs' insistence and willingness of her doctors to support the procedure, we may not be aware of how successful it can be. Thank you very much.
Yes, thank you very much, Bridget. Sorry for these technical problems. You
That's
sent
okay,
the videos to
Stefan.
the technicians, but it was not very well selected. But it's fine, and we are pretty delayed in the program, in the schedule, unfortunately. So let's go for Professor Sefki Arslan, and then we'll speak in the lounge in the evening after 6:30 on specific issues. Okay. Yes, Professor Sefki Arslan, I see here the presentation. You can start.
Okay. I'm the last presenter of this session. I will talk about the therapeutic potential of the bee venom and medicine for cancer treatment. First of all, I would like to thank the organizing committee, and I will start my presentation. As you all know, bees have always had a very special place for human beings due to their agricultural, health, and economical and ecological importance. They produce many products for human, including honey, propolis, and the bee venom. Bee venom has a great deal of attention in these days due to their therapeutic potential. In this slide, you can see the physical and chemical properties of the bee venom. bee venom is an odorless water-like liquid substance with a bitter taste. It's clear acidic solution, and it contains lots of medical ingredients, and that's why they are using in ethnomedicine or for other purposes. Most widely used case in neurodegenerative diseases and the inflammatory diseases. It contains, as I said before, it contains many important ingredients, but the melatonin is the major component of the bee venom. That's why it's great deal of attention due to this therapeutic potential, and it contains enzyme and active amines as well. In our research, we are dealing with the cytotoxic and carcinogenic effects of the bee venom, which is obtained from the Apis mellifera anatolica. For these purposes, we get the bee venom from these bees, and we determine the protein content, and then we check the is it cytotoxic or not to cancer cells. For these purposes, we use the WST method, and you can see the details of these methods in this slide. And we choose 3 different cancer cells. The first one is the colon cancer, namely is CACO2, and the liver cancer, HepG2, and the cervical cancer, HeLa. And we determine the AC50 values of the bee venom. As you can see, it is very effective in the microgram concentration or doses. And the AC50 values for the CACO cells is 35 microgram per ml. For HepG2 cells is 350 microgram per ml, and the HeLa cells it's 40 microgram per ml. And we check after that we check the mechanisms of the cytotoxicity. For these purposes, we look at the proteins mRNA levels, which are involved in the apoptosis and cell division and the tumor suppressor proteins. As you all see, the bee venom is very effective, and they change the expressions of the apoptotic genes, bugs, BCL2, caspases, and the other the proteins. And we found that the expression level of some important genes involved in apoptosis pathway, which are bugs, BCL2, caspase3, and caspase9, which was significantly changed after bee venom was applied to the cancer cells. We observed that the apoptosis was induced in these cancer cells, and the cell division also decreased as a result of the bee venom treatment. After finding these information, we checked the in vivo model of the liver cancer model. I mean, we checked whether bee venom is a good candidate for the liver cancer. For these purposes, we use diethylnitrosamine for inductions of the liver cancer in the rats, and these are our experimental setup. And the left-hand side, you can observe the mechanisms of the diethylnitrosamine induced hepatocellular carcinoma, I mean liver cancer. As you see, we induced the cancer in the rats, in the B, figure B. And when we applied to the 2 doses of the bee venom, which are the C and D, we didn't observe any tumors in these livers. It's very effective for treatment of the liver cancers in the rats. And we checked some of the protein levels by using immunohistochemistry. The first candidate is the alpha fetoprotein. We choose that protein because it is related with the hepatocarcinoma. As you can see in the figure C and D, which are the liver cancer, it is highly expressed, but in the A and the F, it is turned into the normal level. That's why the B venom can reduce the alpha fetoprotein levels easily and prevent the hepatocarcinoma. And also we check the matrix metalloproteinases. We choose that protein because these are involved in the metastasis, and we get the same results as well, like the AFP alpha fetoprotein case. It is increased in the cancer, but it is decreased in the B venom treatment. Therefore, this product B venom is very effective for the prevention of the metastasis as well. Also, we check the PCNA, proliferating cell nuclear antigen level, which are a very important protein in the DNA replication, repair of the DNA damage, and we can obtain the same results in the previous proteins. It is decreased as a result of the B venom treatment. All of these results, also these results was confirmed by the real-time PCR, and all of these results show us the B venom can be used for the treatment of the liver cancer. I think the melittin is responsible for that part because it is involved in the many important biological processes, including cell transformation, proliferation, apoptosis, inflammation, metastasis, and angiogenesis. That's why B venom and the melittin can affect these pathways and involved in the treatment of the many cancers. That's why both of them are so important for me and for other scientists as well. And finally, we checked these B venom is involved in the epigenetic mechanisms. Why we choose the epigenetic mechanisms? These are also important for the cancer development and the cancer treatments. There are lots of drugs that are used in treatments of the such epigenetic diseases, not only in cancer but other diseases, especially for the neurological diseases. We check the DNA methylation enzyme levels and the histone deacetylation levels, and you can easily see that the DNA methylation was significantly reduced as a result of the B venom treatment. Also, histone deacetylation levels also significantly reduced. But the further experiments were required to test these opportunities. These are my PhD student and the Master of Science students that are involved in these projects. Thank you very much for listening. I can answer the questions.
Yes, Professor Aslan. Yes, very good. Excellent presentations of you and all the other colleagues. Very, very good presentations.
Thank you.
Yes, let's. I look to the chat for now. There is no question, but it's wonderful to see that B venom is also an excellent anti-tumoral product and also works through many mechanisms. Okay, so let's see here. Ali, what do you think? Any question for
I think our moderator, Professor Şevki Aslan, has much more to tell, and I am sure that there will be many people who would like to meet with the other presenters, with Professor Meral Kekeçoğlu and Dr. Bridget Goodwin, and the moderator, Professor Şevki Aslan, in the meeting room. If it's possible, I would like to invite them to have a cup of tea in the meeting room at 6:30, while we can receive the participants who would like to ask questions to them and discuss the subject further.
Okay.
Is it okay?
It's okay.
Okay.
That would be lovely. Thank you.
So if you go to the business lunch button and click, and you will find a room for this, and at 6:30 in Turkish time, Bridget. And thank you for your contribution to the Congress from Australia.
Thank you to everyone for inviting me. It's an honor. Thank you.
Pleasure. So if the moderator finished this session, we can go to the other room where there is an interesting topic, epigenetics and apitherapy.
We can finish.
Okay. Thank you. Thank you all.
Thank you
Thank
very
you
much
very
for your attendance.
Thank you.